is Payne Alfonso, and I'll be doing my presentation today on chronic heart failure. What is chronic heart failure? Congestive heart failure is a condition. Let me just put this out here before I get started. Congestive heart failure is used a lot in the research and stuff, but it's the same as chronic heart failure. So congestive heart failure is a condition where the heart does not pump blood as well as it should. It can occur when the heart muscle is too weak or when another defect prevents it from circulating blood properly. So there are 4 stages in heart failure. Well, here's the first 2 here. Stage A. At this stage, you are having other conditions that are linked to heart failure, such as high blood pressure, diabetes, coronary heart disease. Basically saying that you may go talk to your primary care doctor and they say you're having high blood pressure, diabetes, and they will inform you that, okay, you're at risk for heart failure. We're going to maybe do something about it. But they're not super crazy. At this stage, you will never show symptoms of heart failure. Stage B, structural heart disease. This stage is strongly linked to heart failure. This stage includes having enlarged left ventricle or having a heart attack. And later on, I'll show you a picture of what it means by having an enlarged left ventricle. So the next 2 stages would be stage C, showing signs and symptoms. During this stage, someone may be very tired or may even have trouble breathing due to their left ventricle contracting. Most likely, you'd be seeing someone about treatment from previous symptoms. Like that we talked about, the diabetes, the coronary heart disease, and also high blood pressure. The last stage would be stage D, advanced structural heart failure. This stage is very serious and requires special treatment, such as medical support, infusions, cardiac transplant, or even hospice care. So here's when I'll show you the left ventricle, like the swelling of it. So on the left, we have a picture of a heart, what it should look like, and then on the right, we have a congested heart, and it's showing the thickening of the ventricle chambers, and the capacity is getting filled with blood. That's why it's harder to contract in. And you can see the difference. It's pointed out in the picture. So the genetics of it all. Many cardiac disorders can be genetically inherited, including arrhythmias, congenital heart disease, cardiomyopathy, and high blood cholesterol. Those disorders then can lead to heart attack, stroke, and heart failure. So by having those disorders that we talked about first, that then if they're not taken care of properly, that can lead to heart attack, stroke, and heart failure. And then I just have like a little picture that I found on the internet. Basically, you don't just because like we have here on the left, both parents had it. That doesn't mean like you see their kids didn't have it, but then one of their kids had it. So it's just how it goes. And we do see on the right, we have the dad or the male started off with had heart failure, but then no one else in their family had it. So it's just basically all how you take care of yourself. So let's talk about some symptoms of heart failure. Some early symptoms would be fatigue, chills, and fever, and body aches. And a lot of people don't go talk to a caretaker about it just because, we're always tired. Body aches and chills and fever can be common in some people. Some more advanced symptoms would then be sudden weight gain, like 3 or 4 pounds in 2 days, or even 2 pounds like overnight. Shortness of breath all the time, walking upstairs, you become breathless, especially with exertion. Swelling in the legs and ankles, which you guys will know it, ankle edema. Frequent dry cough, most often occurs when laying down. Swelling, bloating in the belly, feeling full sooner when you eat. Loss of appetite, and that's caused you become nauseous, and that's because of the digestive system not receiving less blood, so not receiving the amount of blood it should be receiving. And last, troublesome pain. So our diagnosis, how are you diagnosed with heart failure? And some of these symptoms can be common in your everyday lifestyle. So to be diagnosed with heart failure, your doctor will 1, take a careful medical history, 2, review symptoms and perform medical examinations, check for risk factors such as high blood pressure, coronary artery And with step 1, we also look back into like family history as well. Like you saw, like, does it run in your family? What do we need to be on the lookout for? So the effect of heart failure on exercise response. So researchers found that heart failure patients who participate in relatively vigorous exercise regained had a 23% improvement in their heart function. Vigorous activity improves heart function. There's a reduced risk of death when exercise capacity is increased, and vigorous activity improves circulation and helps the body move better. Also improves balance and joint flexibility. Managing and medication. How do you manage once you have heart failure and you make it through surgery and everything? 1, change your diet. 2, take your medications. And 3, become physically active. All 3 things need to be managed properly so you don't end up back in the hospital. Be sure to attend all follow-up appointments and don't be afraid to reach out to your doctors. They're there to help for a reason. And I want to go back to that. You have to make sure that you're doing all 3 things. A lot of patients and just make sure they're taking the thing. Oh, I'm taking my medication, I'll be okay. But it's not just that. You have to change your diet, eat healthier. You can't be sedentary. You have to be physically active, even if it's just walking your dog. Stay physically active. Medications that are taken, there's like literally so many. So I just pulled out a few that I thought were pretty interesting. 1 would be beta blockers. They lower heart rate and blood pressure, and they're normally used at a very low dosage. 2, ACE inhibitors reduces heart damaging hormones that your body produces. 3, I cannot pronounce that, but they also work just like ACE inhibitors reduce the hormones, the bad hormones. 4, digoxin, diet, I think that's how you say it, slows heart rate and may improve pumping ability to the heart. Like I said, those are just a few important medications that you take with heart failure. There's so many more. It all depends on you. Like if you have your hypertension, like it all depends. So let's get into our case study. We have Miss Herb. She's an 85-year-old lady who is 5'7" and weighs 183 pounds. She has been treated for 2 myocardial infarctions, hypertension, and also has type 2 diabetes. Her last visit was because of chronic heart failure. Her symptoms were shortness of breath during exertion and also had gained 6 pounds within a 7-day-week period. When she arrived at the hospital, her blood pressure was very high at 142/32. So we sat her down and made some goals. Her goals were to change her diet by eating more vegetables, fruits, and whole grains, like bread, rice, pasta, and adding fish into her diet at least twice a week. She also wants to lose 15 pounds by the end of her 36-week cardiac rehab. Changing her diet will help lower Ms. Herb's blood pressure and also help with her weight loss. We also put in here some risks that she has. She does walk with a cane, so she's at risk for falling. So exercise testing that we did at cardiac rehab, there will be an initial 6-minute walk around the cardiac rehab facility. The patient will be allowed to take breaks if necessary, even in the test if the patient is out of breath, dizzy, or have any other chronic risk factors going on. The patient will be hooked up to a monitor where exercise physiologists will be able to see her heart rate, oxygen levels, and blood pressure. The 6-minute walk will then be retaken at the end of rehab, and the goal is to see a decrease in those 3 categories: blood pressure, oxygen, and heart rate. And if she would have to stop for any reason while doing the 6-minute walk, when we retake the test at the end of rehab, we want them to consistently walk the entire 6 minutes with no breaks. So, her exercise prescription. She starts with a treadmill warm-up for 5 minutes at a speed of 2.0. She then moves on, so she stays on the treadmill, but she moves up her speed to 4.5 if she does that for 10 minutes. And then she'll move to the arm ergometer to 10 minutes resistance at a 10 and keep around 25 watts. Then she goes to the bike for a 10-minute bike, and then she'll do a treadmill cool down for 5 minutes at a speed of 1.5. As her 36-week goes, everything will increase. Her warm-ups and cool downs will pretty much stay the same, but her treadmill time, will probably stay around 10 minutes, but we can increase the speed a little bit or even give her a little bit of an incline. With the arm ergometer, her resistance can increase, also with the watts can increase, and her bike time will probably just increase. All exercise should be done at a moderate speed. We want the patient's RPE to be around 3 or 4. Once the patient's RPE drops below a 3, we will increase the intensity and time on each exercise. And if there was ever a point where the patient was saying it was just way too hard, they couldn't do it, we could either reduce the time that they're doing, or we could just have them, like, if we know they can do it, just have them, like, give them some positive feedback and, just keep it at that speed and resistance for a while until they get back down in 3 or 4 range. And the warm up and cool down will always stay the same. I do want to note that if there was ever a time when Ms. Irv came into the cardiac facility and she didn't have the time really to do all her exercises, we would always never cut out the warm up or the cool down. We would just cut down her exercise times. So that's really it. I hope you guys take a lot from this. To basically pay attention to signs and symptoms. Definitely, if you're feeling any of the signs or the symptoms, call 911. I did do a lot of research on that, and a lot of research says to call 911. People who call 911 have a better chance of surviving, just because once you can get the ambulance can come and they can take care of you right away, give you what you need right away. When instead you driving to the ambulance or having someone come and take you to the ER, it just takes up too much time and you're wasting too much valuable time. So always pick up the phone, not your keys. And these are my resources. My last two, I just had the URL in there because it was really hard to cite. It was like not really a title to anything and no author. So I'll just